This is Chris Dyksel's speech on medical marijuana. There's Chris. These are his 5 audience members.
Go. Good? Okay. So, new technology is normally something that progresses society forward, that benefits mankind in some way. A new technology that has recently come out is marijuana being used as a medical product. Many illnesses such as AIDS, multiple sclerosis, and cancer have many side effects that marijuana has been proven to help out in. Many patients are very skeptical about becoming a medical marijuana user, mainly because of the stereotypes that come along with marijuana as a drug. But overall, when used properly, medical marijuana has been proven to help out patients with ill side effects such as nausea, muscle cramps, muscle fatigue, sleep apnea, sleeping problems in general. Marijuana has been proven to help out in. I give a little background information on marijuana. In 1996, Proposition 215 was passed, in which it states that it is legal for a person to possess and ingest marijuana if they have a legal prescription. Currently, as of right now, only 12 out of the 50 states have medical marijuana laws. In the other states, marijuana is legal. Federally, marijuana is also legal. It is treated as a drug and is punishable by law. Since federal crimes override since federal laws override state laws, it is technically illegal federally to possess and ingest marijuana. But yet, within the state boundaries, it is still legal. This can get very confusing to people who do not educate themselves on the laws of marijuana, including police officers. Laws for medical marijuana, it is illegal to carry more than an ounce on you at any one point in time. Many states would agree to allow medical marijuana patients to ingest inside their state boundaries if they had more information put up for marijuana being used as a medical product. But in fact, there is a plethora of information out there that states that marijuana is and can be used to help cope with the problems associated with cancer, multiple sclerosis, and many other illnesses and diseases. Former Surgeon General Jocelyn Elders states that the evidence is overwhelming that marijuana can help patients cope with their painful side effects. Overall, marijuana has been proven that it is a muscle relaxant, so it relaxes muscle cramps and fatigue, which is commonly associated with people going for chemotherapy for cancer or with multiple sclerosis dealing with swelling. It has been proven also that it helps relax a patient if they cannot keep their food down, if they throw it up, or with nausea. If marijuana had more advocates for a lot more patients would be more willing to try it. That is one of the reasons why a lot of patients are almost not willing to try marijuana, because there's not a lot of word being spread about marijuana. You really just can't go into a doctor's office and just kind of sit down and be like, so, medical marijuana, tell me more about it. You have to go to a specific doctor, which a lot of patients find a little skeptical. Also, a lot of patients are really concerned about the physical effects of ingesting it into your lungs and how it can cause problems. They're also afraid of the image that it portrays and just overall the lack of knowledge on the subject. Many advocates for marijuana, such as Montel Williams, he has been diagnosed with multiple sclerosis since the mid-90s, and ever since then he has been on multiple medications and found that the side effects of them are overwhelming. Marijuana, to him, he has stated that marijuana has helped him out a lot with dealing with his problems with multiple sclerosis, mainly with swelling within his eyes. He said the pain is unbearable and that marijuana has helped him cope with it. There are definitely some skepticism about marijuana being legalized not only as a medical product, but also in general. Time magazine printed an article in 2006. It was an interview with the doctor, and it gave information stating that marijuana over long-term use can shrink the oblongata and the hippocampus, which both have to do with memory surplus, which pretty much just keep storages of memory. Both of them, when they do shrink, you start to lose your short-term memory. They also have to do with feelings and situations. So, I mean, there are definitely some side effects associated with marijuana over long-term usage, but there's more studies being done definitely around the subject. In conclusion, when people educate themselves in the subject area of medical marijuana, they will soon realize that if they keep an open mind, it is another drug out there that could potentially help people who are ill and sick and that need it most. Thank you.
Legalize.
You guys have any questions?
Yeah, I do. You were saying, talking about side effects from other medication. Are there studies that show that smoking will like lower your immune system, lower your overall sperm count?
There actually has been some studies that marijuana can lower your sperm count, but it's not necessarily the THC that lowers your sperm count, it's the actual smoke. Marijuana and cigarettes both. Any smoke ingested inside your lungs can actually lower your sperm count. It's
Well, how would someone like get across it if they wanted to use medical marijuana?
And if you want to use medical marijuana to like have a child?
Well, yeah, because like, smoking will cause bad side effects. Like, is there other ways to like ingest it?
Yeah, there definitely are other ways to ingest it. There's edibles. You can eat marijuana if you cook it. There's also vaporizers. You can vaporize it, so it's pretty much just hot air. There's foods, teas. You can drink it. Pretty much just do about anything except shoot it up and snort it. But other than that, it should be good. Yes.
Does it permanently erase your short-term memory, or if you stop smoking, does it come back?
Yeah, there has been studies that if you stop smoking, pretty much go cold turkey for more than over 2 years. People who were smoking for 15 years showed a shrinkage of the hippocampus and oblongata, and when they stopped smoking for 4 years, they started gaining it back. So it started resizing, going back to its normal state.
But like smoking like, you had to smoke a lot of 15 years for it to shrink that much.
They just did it with patients who have been smoking 10 to 15 years.
Okay.
This is a study done at the University of Oregon, I believe. Yeah, University of Oregon.
But it wouldn't say someone who doesn't smoke that much, they wouldn't need 4 years to get back to normal state with it.
I imagine it would change from person to person, but they did it with, I think, nine people. Yeah, 9 people.
Oh.
Yes.
You know how you said something about how the crap, I forgot. Never mind.
It happens.
It
happens. Is that it?
That's it.
Okay.
Good?